Question 1. A client with COPD suddenly becomes restless, tachycardic, and has an SpO2 of 86% despite being on 2-liter O2 via nasal cannula. What is the nurse's priority action? A. Increase O2 to 4 liters per minute. B. Notify the provider immediately. C. Place the client in high Fowler's position. D. Assess for cyanosis. Answer. C. Place the client in high Fowler's position. Rationale. Positioning improves lung expansion and oxygenation quickly. Increasing O2 without provider order may worsen CO2 retention in COPD. Assessment and notification are important, but not the first priority. Question 2. A client with heart failure reports shortness of breath and has crackles in both lung bases. Which order should the nurse implement first? A. Administer furosemide 40 mg IV. B. Restrict oral fluids. C. Monitor daily weight. D. Elevate legs on pillows. Answer. A. Administer furosemide 40 mg IV. Rationale. IV diuretic administration addresses acute fluid overload and pulmonary congestion immediately, preventing worsening respiratory distress. Question 3. A post-op client suddenly develops chest pain, dyspnea, and tachycardia. What is the nurse's first priority? A. Call rapid response. B. Apply oxygen at 10 liters per minute non-rebreather. C. Notify the surgeon. D. Obtain an ECG. Answer. B. Apply oxygen at 10 liters per minute non-rebreather. Rationale. Symptoms suggest pulmonary embolism. Oxygenation is the immediate priority before further actions. Question 4. A nurse is caring for 4 clients. Which one should be assessed first? A. A client with diabetes reporting tingling in both feet. B. A post-op appendectomy client with pain rated 7 out of 10. C. A client with pneumonia with an SpO2 of 84%. D. A client receiving antibiotics reporting nausea. Answer. C. A client with pneumonia with an SpO2 of 84%. Rationale. Oxygenation always takes priority. SpO2 less than 90% indicates severe hypoxemia requiring immediate intervention. Question 5. A nurse is preparing to administer IV potassium chloride. Which action is essential? A. Dilute in 100 milliliters of NS and infuse over 1 hour. B. Administer via 4-push. C. Mix with dextrose 5% in water. D. Give IM if IV access unavailable. Answer. A. Dilute in 100 milliliters of NS and infuse over 1 hour. Rationale. Potassium is never given IV push or IM due to risk of cardiac arrest. It must be diluted and infused slowly. Question 6. A nurse is delegating care to a nursing assistant. Which task is appropriate? A. Educating a client about diabetes management. B. Obtaining vital signs from a stable client. C. Assessing wound drainage. D. Administering oral medications. Answer. B. Obtaining vital signs from a stable client. Rationale. Vital signs on stable clients can be delegated. Education, assessment, and medication administration require RN scope. Question 7. A client with liver cirrhosis develops confusion and hysterexis. Which lab result does the nurse expect? A. Low potassium. B. Elevated ammonia. C. Low albumin. D. High calcium. Answer. B. Elevated ammonia. Rationale. Hepatic encephalopathy occurs due to elevated ammonia levels affecting brain function. Question 8. A client receiving chemotherapy has a WBC count of 1,800 per cubic millimeter. Which action is priority? A. Place in a protective isolation room. B. Encourage fresh fruits and vegetables. C. Administer pain medication. D. Allow family to visit freely. Answer. A. Place in a protective isolation room. Rationale. Neutropenia, WBC less than 2,000. Increases infection risk, requiring protective isolation. Question 9. A client with a chest tube for pneumothorax has continuous bubbling in the water seal chamber. What should the nurse do first? A. Clamp the chest tube immediately. B. Notify the healthcare provider. C. Check for an air leak in the system. D. Increase suction. Answer. C. Check for an air leak in the system. Rationale. Continuous bubbling indicates an air leak. Clamping or increasing suction is unsafe without identifying the source. Question 10. A nurse is caring for a client with diabetes who is NPO for surgery but receives scheduled insulin. What is the priority action? A. Administer insulin with a sip of water. B. Hold insulin and notify provider. C. Give half the usual insulin dose. D. Administer insulin with IV fluids. Answer. B. Hold insulin and notify provider. Rationale. Giving insulin while NPO can cause hypoglycemia. Provider must adjust dose based on surgery status. Question 11. A client on warfarin has an INR of 5.6. What is the priority action? A. Administer vitamin K as ordered. B. Increase monitoring frequency. C. Withhold the next dose of warfarin. D. Encourage foods high in vitamin K. Answer. A. Administer vitamin K as ordered. Rationale. INR greater than 5 indicates high risk of bleeding. Immediate reversal with vitamin K is required. Question 12. A client develops urticaria and difficulty breathing after IV antibiotic administration. What is the nurse's first action? A. Stop the infusion. B. Administer epinephrine. C. Notify the provider. D. Provide reassurance. Answer. A. Stop the infusion. Rationale. First action in suspected anaphylaxis is to stop the offending drug. Epinephrine follows immediately. Question 13. A nurse finds a client on the floor who states they slipped while walking. What should the nurse do first? A. Notify the provider. B. Check for injuries and vital signs. C. Assist client back to bed. D. Complete incident report. Answer. B. Check for injuries and vital signs. Rationale. Safety and assessment take priority before documentation or notification. Question 14. A client with hypoglycemia, blood glucose 45 mg per deciliter, is conscious but confused. What is the nurse's best action? A. Administer 50% dextrose, IV. Give 4 ounces of orange juice. C. Notify the provider. D. Recheck glucose in 15 minutes. Answer. B. Give 4 ounces of orange juice. Rationale. For conscious hypoglycemic clients, oral fast-acting carbohydrate is the immediate treatment. Question 15. A client receiving TPN develops dyspnea, chest pain, and tachycardia. What should the nurse do first? A. Slow the TPN rate. B. Clamp the catheter and place client on left side. C. Notify the provider. D. Increase IV fluids. Answer. B. Clamp the catheter and place client on left side. Rationale. Signs suggest air embolism. Left side positioning traps air in right atrium and prevents embolism from entering circulation. Question 16. A nurse is preparing to administer digoxin to a client with apical pulse of 48 BPM. What is the correct action? A. Administer the dose. B. Hold the dose and notify the provider. C. Give half the dose. D. Recheck pulse in 30 minutes. Answer. B. Hold the dose and notify the provider. Rationale. Digoxin is held if heart rate less than 60 BPM due to risk of toxicity and bradycardia. Question 17. A client with chronic kidney disease reports muscle cramps and has a serum potassium of 6.8 milliequivalent per liter. What is the priority action? A. Prepare to administer sodium polystyrene sulfonate. B. Place client on cardiac monitor. C. Restrict potassium-rich foods. D. Encourage oral fluids. Answer. B. Place client on cardiac monitor. Rationale. Potassium greater than 6.5 is life-threatening. Cardiac monitoring prevents sudden arrhythmias, while other interventions are arranged. Question 18. A client on mechanical ventilation has high-pressure alarm sounding. What is the nurse's first action? A. Suction the client's airway. B. Check tubing for kinks. C. Reassure the client. D. Call respiratory therapy. Answer. B. Check tubing for kinks. Rationale. Always check equipment first when alarms sound. Obstruction must be ruled out before suctioning. Question 19. A client with DKA is receiving IV insulin. Which intervention is priority? A. Monitor for hypokalemia. B. Restrict fluid intake. C. Monitor for hypoglycemia. D. Assess for metabolic alkalosis. Answer. A. Monitor for hypokalemia. Rationale. IV insulin drives potassium into cells, risking hypokalemia, which can cause arrhythmias. Question 20. A nurse is caring for a client post-thyroidectomy who reports tingling around mouth and fingers. What is the priority action? A. Assess for Chvostek sign. Notify provider and prepare to give IV calcium. C. Administer oxygen. D. Reassure client symptoms are temporary. Answer. B. Notify provider and prepare to give IV calcium. Rationale. Tingling indicates hypocalcemia from parathyroid damage. Immediate IV calcium prevents tetany and laryngeal spasm. Question 21. A nurse is caring for a client with burns over 40% body surface area. Which assessment finding requires immediate intervention? A. Pain rated 9 out of 10. B. Urine output 20 milliliters per hour. C. Elevated heart rate. D. Edema at burn site. Answer. B. Urine output 20 milliliters per hour. Rationale. Oliguria indicates hypovolemia and inadequate renal perfusion, requiring immediate fluid resuscitation. Question 22. A client with a tracheostomy suddenly becomes unable to breathe. What is the nurse's first action? A. Call rapid response. B. Remove inner cannula and suction. C. Ventilate with AMBA bag. D. Replace tracheostomy tube. Answer. B. Remove inner cannula and suction. Rationale. The most common cause is mucus plug. Suctioning is the first life-saving action before tube replacement. Question 23. A client with Alzheimer's disease is agitated and wanders at night. What is the most appropriate nursing action? A. Administer sedative medication. B. Provide a safe, structured environment. C. Place client in restraints at night. D. Reorient client every 15 minutes. Answer. B. Provide a safe, structured environment. Rationale. Safety and routine reduce agitation. Restraints and sedatives are last resorts. Question 24. A client receiving morphine IV develops respiratory rate of 6 per minute and unresponsiveness. What is the nurse's priority? A. Call rapid response. B. Administer naloxone. C. Provide oxygen. D. Reassess vital signs. Answer. B. Administer naloxone. Rationale. Naloxone is the antidote for opioid overdose and must be given immediately. Question 25. A client with stroke has right-sided weakness and difficulty swallowing. What is the nurse's priority intervention? A. Place suction at bedside. B. Feed client with soft foods. C. Refer to speech therapy. D. Elevate HOB during meals. Answer. D. Elevate HOB during meals. Rationale. Elevating HOB reduces aspiration risk, which is the highest priority in dysphagia. Question 26. A client with sepsis is receiving IV fluids. BP is 82 over 40 millimeters of mercury, heart rate 128, and urine output 15 milliliters per hour. What is the nurse's priority? A. Increase IV fluids as ordered. B. Place client in Trendelenburg position. C. Notify the provider of hypotension. D. Administer prescribed antibiotics. Answer. A. Increase IV fluids as ordered. Rationale. Hypotension and oliguria indicate poor perfusion. Fluid resuscitation is the first priority to stabilize circulation before antibiotics. Question 27. A nurse is caring for a client with a chest tube. Suddenly, The tube is dislodged from the chest. What should the nurse do first? A. Cover the site with a petroleum gauze. B. Call rapid response. C. Reinsert the chest tube. D. Apply a dry sterile dressing. Answer. A. Cover the site with a petroleum gauze. Rationale. This prevents air from entering the pleural space and worsening pneumothorax until the tube is replaced. Question 28. A client receiving heparin infusion for a DVT has a PTT of 120 seconds. What is the nurse's priority? A. Continue infusion as ordered. B. Stop infusion and notify provider. C. Administer vitamin KD, encourage ambulation. Answer. B. Stop infusion and notify provider. Rationale. A PTT of 120 seconds is critically high and increases bleeding risk. Infusion should be held and provider contacted. Question 29. A client with end-stage renal disease is scheduled for hemodialysis today. Morning labs show potassium 6.5 milliequivalent per liter. What is the priority nursing action? A. Place client on a cardiac monitor. B. Notify dialysis nurse. C. Hold morning antihypertensives. D. Check for bruit and thrill over fistula. Answer. A. Place client on a cardiac monitor. Rationale. Hyperkalemia greater than 6.0 is life-threatening. Cardiac monitoring prevents sudden arrhythmias while preparing dialysis. Question 30. A nurse is caring for a client post-thyroidectomy. Which assessment requires immediate intervention? A. Hoarseness and weak voice. B. Tingling of lips and fingers. C. Sore throat and mild pain. D. Edema at incision site. Answer. B. Tingling of lips and fingers. Rationale. This indicates hypocalcemia from parathyroid injury and requires urgent IV calcium to prevent tetany. Question 31. A client with cirrhosis develops ascites and confusion. Which order should the nurse implement first? A. Administer lactulose. B. Restrict sodium intake. C. Obtain daily weights. D. Elevate head of bed. Answer. A. Administer lactulose. Rationale. Lactulose reduces ammonia levels, treating hepatic encephalopathy and preventing worsening confusion. Question 32. A client in labor suddenly develops dyspnea, hypotension, and cyanosis. What is the nurse's priority? A. Start IV fluids wide open. B. Administer high-flow oxygen. C. Notify the obstetrician. D. Position client on left side. Answer. B. Administer high-flow oxygen. Rationale. These are signs of amniotic fluid embolism. Oxygen is the first life-saving intervention before other actions. Question 33. A client with pneumonia is receiving IV antibiotics. Which assessment finding requires immediate intervention? A. Rash and itching. B. Temperature 102 degrees Fahrenheit. C. Productive cough with green sputum. D. Crackles in lungs. Answer. A. Rash and itching. Rationale. Rash may indicate allergic reaction or anaphylaxis to antibiotics. This must be acted on immediately. Question 34. A client with acute pancreatitis is NPO with an NG tube. The client reports increasing abdominal pain and fever. Which is the priority? A. Check NG2 patency. B. Administer prescribed morphine. C. Notify provider of possible infection. D. Reassure client pain is expected. Answer. A. Check NG2 patency. Rationale. Increased pain and fever may indicate blocked drainage and complications. Ensuring NG patency prevents worsening pancreatitis. Question 35. A client with a central venous catheter develops sudden shortness of breath and tachycardia during IV infusion. What is the first action? A. Stop the infusion and clamp the catheter. B. Notify the healthcare provider. C. Place the client on the left side in Trendelenburg. D. Administer oxygen. Answer. A. Stop the infusion and clamp the catheter. Rationale. This prevents more air or fluid embolism. Then positioning and oxygen follow. Question 36. A nurse is assessing 4 clients. Which one should be seen first? A. A client with COPD with barrel chest. B. A post-op hip replacement with pain 7 out of 10. C. A client with DKA with fruity breath. D. A client with pneumonia with respiratory rate 34 and restlessness. Answer. D. A client with pneumonia with respiratory rate 34 and restlessness. Rationale. Severe tachypnea and restlessness indicate hypoxemia, which requires immediate intervention. Question 37. A client with suspected meningitis is placed in a shared room. Which is the priority nursing action? A. Place client in droplet isolation. B. Keep client in semi-Fowler's position. C. Provide 4 fluids as ordered. D. Monitor neurological status. Answer. A. Place client in droplet isolation. Rationale. Preventing transmission is priority. Meningitis is droplet spread. Question 38. A client with diabetes is found unconscious with blood glucose 30 milligrams per deciliter. What is the nurse's priority? A. Administer IV dextrose 50%. B. Give orange juice. C. Notify provider. D. Recheck glucose in 15 minutes. Answer. A. Administer IV dextrose 50%. Rationale. Unconscious hypoglycemic patients require IV dextrose immediately since oral intake is unsafe. Question 39. A client with a spinal cord injury above T6 develops sudden hypertension, headache, and diaphoresis. What is the priority? A. Administer antihypertensive medication. B. Sit client upright and loosen clothing. C. Notify provider immediately. D. Check urinary catheter for kinks. Answer. B. Sit client upright and loosen clothing. Rationale. This is autonomic dysreflexia. First intervention is positioning to lower BP. Then check for triggers. Question 40. A client with a fractured femur develops sudden shortness of breath, chest pain, and confusion. What is the nurse's first action? A. Notify provider immediately. B. Apply high-flow oxygen. C. Administer IV morphine. D. Reposition client. Answer. B. Apply high-flow oxygen. Rationale. Symptoms suggest fat embolism. Oxygen is the immediate priority. Question 41. A client with heart failure is receiving IV furosemide. Which finding requires immediate intervention? A. Tinnitus. B. Weight loss of 1 kilogram overnight. C. Serum potassium 2.9 milliequivalent per liter. D. Increased urine output. Answer. C. Serum potassium 2.9 milliequivalent per liter. Rationale. Hypokalemia is life-threatening and increases risk of arrhythmias. Question 42. A nurse is caring for a client post-splenectomy. Which assessment finding is priority? A. Fever of 101.4 degree F/B. Pain at surgical site. C. Nausea after eating. D. Fatigue. Answer. A. Fever of 101.4 degree F. Rationale. Clients without a spleen are at high risk of infection. Fever is a red flag requiring immediate intervention. Question 43. A client with Guillain-Barré syndrome develops respiratory distress. What is the nurse's priority? A. Prepare for intubation. B. Administer oxygen. C. Notify provider. D. Place in high Fowler's. Answer. A. Prepare for intubation. Rationale. Paralysis can progress to respiratory failure. Securing the airway is the highest priority. Question 44. A client with myocardial infarction is receiving morphine IV. Which finding requires immediate intervention? A. Pain 6 out of 10. B. Respiratory rate 8 per minute. C. Blood pressure 130 over 80 mmHg. D. Drowsiness. Answer. B. Respiratory rate 8 per minute. Rationale. Morphine can cause respiratory depression. Respiratory rate less than 10 is life-threatening. Question 45. A client with cirrhosis has hematemesis. What is the nurse's first action? A. Insert NG tube for suction. B. Place client in sideline position. C. Prepare for endoscopy. D. Administer proton pump inhibitor. Answer. B. Place client in sideline position. Rationale. This prevents aspiration while awaiting definitive treatment. Question 46. A client is receiving IV vancomycin. The nurse notes flushing, hypotension, and itching. What is the priority action? A. Stop infusion immediately. B. Administer diphenhydramine. C. Notify provider. D. Document reaction. Answer. A. Stop infusion immediately. Rationale. These are signs of red man syndrome. Infusion should be stopped to prevent worsening reaction. Question 47. A nurse is caring for a client with Addison's disease who is weak and dizzy. BP is 70/40 millimeters of mercury. What is the priority intervention? A. Administer IV hydrocortisone. B. Provide oral fluids. C. Recheck vital signs. D. Place client in supine position. Answer. A. Administer IV hydrocortisone. Rationale. Addisonian crisis causes severe hypotension. IV corticosteroids are life-saving. Question 48. A client receiving blood transfusion develops fever, chills, and back pain. What is the nurse's first action? A. Slow the transfusion rate. B. Stop the transfusion immediately. C. Notify provider. D. Administer acetaminophen. Answer. B. Stop the transfusion immediately. Rationale. This is a transfusion reaction. Stopping the transfusion is priority before further interventions. Question 49. A client with asthma is using albuterol inhaler every 2 hours without relief. What should the nurse do first? A. Educate on overuse of inhaler. B. Notify provider immediately. C. Administer corticosteroid inhaler. D. Check oxygen saturation. Answer. D. Check oxygen saturation. Rationale. The priority is to assess oxygenation before contacting provider or giving further medication. Question 50. A client with traumatic brain injury has increased ICP. Which intervention is priority? A. Elevate head of bed 30 degrees. B. Suction frequently. C. Restrict fluids. D. Place client in Trendelenburg position. Answer. A. Elevate head of bed 30 degrees. Rationale. HOB elevation promotes venous drainage and reduces ICP. Trendelenburg and frequent suctioning worsen ICP. Question 51. A client with COPD develops sudden worsening dyspnea, cyanosis, and confusion. SpO2 is 82% on 2-liter O2. What is the nurse's first action? A. Increase O2 to 4 liters per minute via nasal cannula. B. Call respiratory therapy. C. Place client in high Fowler's position. D. Notify provider. Answer. C. Place client in high Fowler's position. Rationale. Positioning improves lung expansion and oxygenation immediately. Increasing O2 without positioning may be insufficient, especially in COPD clients. Question 52. A client post-MI has sudden chest pain radiating to jaw, HR 140, BP 88/50, and diaphoresis. What is the priority nursing action? A. Administer prescribed nitroglycerin. B. Call rapid response. C. Start IV fluids. D. Obtain a 12-lead ECG. Answer. B. Call rapid response. Rationale. Symptoms indicate possible cardiogenic shock or reinfarction. Immediate rapid response activation ensures rapid interventions for a life-threatening condition. Question 53. A client with end-stage renal disease has potassium 6.8 milliequivalent per liter and HR 42 BPM. Which action is priority? A. Administer oral Kxalate. B. Place client on cardiac monitor. C. Restrict dietary potassium. D. Notify provider after routine check. Answer. B. Place client on cardiac monitor. Rationale. Hyperkalemia with bradycardia is life-threatening. Cardiac monitoring detects arrhythmias, while other treatments are arranged. Question 54. A client with a chest tube reports sudden chest pain and dyspnea. Drainage system is intact. What should the nurse do first? A. Check tubing for kinks or obstructions. B. Notify provider. C. Apply oxygen. D. Clamp the tube. Answer. A. Check tubing for kinks or obstructions. Rationale. Sudden pain and dyspnea may be caused by obstruction. Equipment check is priority before calling provider or applying interventions. Question 55. A client with type 1 diabetes is NPO for surgery. Morning glucose is 58 milligrams per deciliter. What is the nurse's first action? A. Administer half insulin dose. B. Give IV dextrose 10%. C. Notify provider before giving insulin. D. Recheck glucose in 30 minutes. Answer. C. Notify provider before giving insulin. Rationale. Giving insulin while NPO can cause severe hypoglycemia. Provider must adjust dose before administration. Question 56. A client post-thyroidectomy has stridor and accessory muscle use. What is the nurse's priority action? A. Administer oxygen. B. Notify provider and prepare for intubation. C. Elevate HOB. D. Reassure client. Answer. B. Notify provider and prepare for intubation. Rationale. Stridor indicates airway obstruction from edema or hematoma. Airway protection is the priority. Question 57. A client with Addison's disease reports weakness, dizziness, and BP 72 over 40 millimeters of mercury. Which action is priority? A. Give oral fluids. B. Place in supine position. C. Administer IV hydrocortisone. D. Recheck vitals in 15-minute. Answer. C. Administer IV hydrocortisone. Rationale. Addisonian crisis is life-threatening. Immediate for corticosteroids correct hypotension and adrenal insufficiency. Question 58. A client post-abdominal surgery has absent bowel sounds and abdominal distension. Which action should the nurse take first? A. Administer prescribed laxative. B. Notify provider. C. Encourage oral fluids. D. Document findings. Answer. B. Notify provider. Rationale. Absent bowel sounds with distension may indicate ileus or obstruction. Provider needs to evaluate before giving laxatives or fluids. Question 59. A client on warfarin has IN R6.2 and hematuria. What is the priority nursing action? A. Hold warfarin and notify provider. B. Monitor urine output. C. Encourage fluids. D. Administer vitamin K without order. Answer. A. Hold warfarin and notify provider. Rationale. IN are greater than 6 with bleeding is life-threatening. Holding medication and notifying provider prevents further hemorrhage and guides reversal therapy. Question 60. A client with DKA has potassium ion 2.8 milliequivalent per liter. Insulin infusion is running. What is the nurse's priority? A. Continue insulin as ordered. B. Administer IV potassium. C. Restrict fluids. D. Encourage oral potassium. Answer. B. Administer IV potassium. Rationale. Insulin lowers potassium further, risking cardiac arrhythmias. IV potassium is critical before continuing insulin. Question 61. A client with stroke has right-sided weakness and swallowing difficulty. Which intervention has highest priority? A. Elevate HOB during meals. B. Place suction at bedside. C. Provide soft diet. D. Refer to speech therapy. Answer. A. Elevate HOB during meals. Rationale. Preventing aspiration is the most immediate safety concern in dysphagia. Question 62. A client with fat embolism syndrome develops sudden dyspnea, tachycardia, and confusion. What is the priority? A. Notify provider. B. Administer oxygen. C. Position client supine. D. Start IV fluids. Answer. B. Administer oxygen. Rationale. Oxygenation is the immediate life-saving intervention. Positioning and fluids follow. Question 63. A client with acute MI develops HR42 BPM and dizziness. Which action is priority? A. Administer atropine as ordered to B. Place on cardiac monitor to C. Recheck vitals in 15 minutes. D. Notify provider. Answer. A. Administer atropine as ordered. Rationale. Symptomatic bradycardia post-MI is life-threatening. Atropine is indicated to prevent decreased cardiac output. Question 64. A client with pneumonia has SpO2 88% on 2-liter O2 and restlessness. What should the nurse do first? A. Increase oxygen to 4 liters per minute. B. Notify provider. C. Encourage deep breathing. D. Place client in high Fowler's position. Answer. D. Place client in high Fowler's position. Rationale. Positioning improves ventilation immediately. Oxygen and provider notification follow. Question 65. A client receiving heparin develops platelets 45,000 per cubic millimeter. What is the priority action? A. Continue infusion as ordered to B. Hold heparin and notify provider. C. Administer vitamin KD, monitor bleeding. Answer. B. Hold heparin and notify provider. Rationale. Low platelets indicate possible heparin-induced thrombocytopenia. Immediate discontinuation is critical. Question 66. A client with mechanical ventilation triggers high-pressure alarm. What should the nurse do first? A. Suction airway. B. Check for kinks or obstruction. C. Notify respiratory therapy. D. Increase sedation. Answer. B. Check for kinks or obstruction. Rationale. Always assess equipment first. Obstruction is most common cause of high-pressure alarms. Question 67. A client with pneumonia on IV antibiotics develops rash, itching, and facial swelling. Priority action. A. Stop infusion immediately. B. Administer antihistamine. C. Notify provider. D. Document reaction. Answer. A. Stop infusion immediately. Rationale. Signs indicate anaphylaxis. Stopping infusion is life-saving. Question 68. A client with DVT is receiving IV heparin and reports severe back pain and dark urine. What is the first action? A. Continue infusion. B. Notify provider immediately. C. Encourage hydration. D. Assess pain intensity. Answer. B. Notify provider immediately. Rationale. Signs of heparin-induced bleeding. Urgent provider notification is required. Question 69. A client post-op develops sudden hypotension, tachycardia, and decreased urine output. Which action is priority? A. Call rapid response. B. Increase IV fluid rate. C. Assess surgical site for bleeding. D. Administer pain medication. Answer. B. Increase IV fluid rate. Rationale. Hypovolemic shock is suspected. Rapid fluid resuscitation is life-saving while other assessments occur. Question 70. A client with chest tube reports continuous bubbling in water seal chamber. What is the first action? A. Clamp the tube. B. Notify provider. C. Check for air leak in system. D. Increase suction. Answer. C. Check for air leak in system. Rationale. Continuous bubbling usually indicates an air leak. Identifying the source is essential before other interventions. Question 71. A client with hypoglycemia, BG 35 mg per deciliter, is alert but shaking. What is the priority? A. Administer IV dextrose. B. Give 4-ounce orange juice. C. Notify provider. D. Recheck glucose in 15 minutes. Answer. B. Give 4-ounce orange juice. Rationale. Conscious hypoglycemic clients should receive fast-acting oral carbohydrate immediately. Question 72. A client with stroke has sudden right-sided facial droop and slurred speech. What is the first action? A. Call rapid response. B. Assess airway, breathing, circulation. C. Administer aspirin. D. Notify provider. Answer. B. Assess airway, breathing, circulation. Rationale. ABCs are priority. Stroke interventions follow after stabilization. Question 73. A client with hypothyroidism is prescribed levothyroxine. Which statement indicates correct understanding? A. I will take it at bedtime with food. B. I will take it in the morning before breakfast. C. I will take it only when I feel tired. D. I will stop it when symptoms improve. Answer. B. I will take it in the morning before breakfast. Rationale. Levothyroxine absorption is best on empty stomach, bedtime, or with food reduces efficacy. Question 74. A client post-thoracentesis reports sudden dyspnea and anxiety. What is the first action? A. Apply oxygen. B. Notify provider. C. Assess for pneumothorax. D. Reposition client upright. Answer. D. Reposition client upright. Rationale. Upright positioning improves ventilation and oxygenation. Assessment and notification follow. Question 75. A client with severe burns over 50% BSA is hypotensive and tachycardic. What is the nurse's first priority? A. Administer IV fluids rapidly. B. Start pain management. C. Apply sterile dressings. D. Assess for airway patency. Answer. D. Assess for airway patency. Rationale. Airway compromise is life-threatening. Fluid resuscitation follows airway stabilization. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.